I will tell in the beginning about the roots of the superinductive system. Then we will go through the clinical background and the therapy guide. Then we will go through the hands-on and product features. During today's webinar, I would like to show you in practice. I will show you a small demonstration how this technology works, because in my opinion, this is this kind of technology which we should feel, we should hear, and we should see. What I am presenting you today is superinductive system, and it is definitely the patient's hero, because this is the quick pain management, and we can treat patients very easily, very fast. It shortens the recovery process of your patients and resumes the daily activities of your patients. And from the other side, it is also the therapist hero, because this is very easy procedure. It is very easy to use. It is very comfortable for the patient. And also it develops your clinics, because if we are thinking about treating patients globally, not locally, we can do at the same time, during using the superinductive system, we can do other methods, other manual methods with the patient. What we can do with superinductive system as well in our clinic, we can increase the number of the patients, because actually this device can support, or it can substitute some of your work, some of your methods you are working with the patients. So let's go through the technology background, because the magnetic field is well known in the medicine. So the most common topic which is showing in your minds is definitely that this is magnetic field uses for MRI for diagnostic purposes, and there we are using the stationary magnetic fields. Where we are using also the magnetic fields is in neurology, and this is very common topic as well. And we are using it with the transcranial magnetic stimulation. The difference between those two electromagnetic fields is that in the MRI, we are using the stationary magnetic field, and in transcranial magnetic stimulation and superinductive system, we are using the pulse magnetic fields. In those three topics, we are using over 1 Tesla of intensity. So this is a huge advantage in this case. Regarding the physical therapy and rehabilitation, when we use the magnetic field and we use the intensities up to 1 Tesla, we create the depolarization of the nerve and the muscle contraction. So our treatment purpose of superinductive system, it will be definitely the myostimulation. It will be definitely joint mobilization. I will tell you something more about these topics, but the main and the most important principle is the pain relief, because as a physiotherapist, most of our patients who come to the clinic, to the physiotherapist office, is the patient with the pain. Let's not think right now about the root of the pain, because the root of the pain, it's different in every patient. And is it patient with the acute disease? Is it the patient with the chronic disease? Every pain is different. So this is the device which will work with a few pain theories, and we can manage the pain with this device. What is also the huge advantage of this technology is the fracture healing. I will say something more about this later on. The other option to work with the patient also is to work with the neurological patients, for example, post-stroke patients with the cerebral palsy, to decrease their spasticity. And this is a great option to prepare patients to some kind of exercises, to gait therapy, to the hand therapy, to decrease the spasticity before working with the patient manually. So what is actually the superinductive system about? So the mechanism of action is that the coil in the applicator here generates high-intensity pulsed electromagnetic field. And this electromagnetic field interacts with the human body and causes depolarization of the nerve and the muscle. So what is the effect? Actually, the effect we can see and we can feel and we can hear, because you will see how the tissue reacts, like the vibration, like the tingling, like the contracture of the muscle, or stimulation of the nerve. So we exactly see that this device works on the tissue, and the tissue reacts on this modality. So the therapeutic effect, as I told you before, the main and the most important for us is the pain management. So we work with the patient to relieve their pain. And other therapeutic effects we can reach is joint mobilization, fracture healing, myostimulation, spasticity reduction, and let's say in general, we can work with the neuromuscular and joint skeletal disorders. So almost every patient who comes to your clinic can be treated by this device. You may think, okay, so what is the difference between those two? So we are using in the superinductive system the biological effects of the magnetotherapy and the electrotherapy, but in a different way. Because actually, what is the difference between a superinductive system and magnetotherapy? In superinductive system, we are using the intensity of 2.5 Tesla maximum. So we are using the Tesla units. Regarding the magnetotherapy, in magnetotherapy, we are using the intensity up to tens of millitesla. So the difference is huge. So we are actually supporting the healing process with this device, with the superinductive system, but much, much more intensive than we use it with magnetotherapy. And due to the low intensity of the field, with magnetotherapy, it is impossible to achieve the nerve depolarization and muscle contraction. In superinductive system, we are achieving this, and in this case, we can cover many symptoms at once. What else is regarding the difference between magnetotherapy, but as well with the electrotherapy, it is the depth of the penetration of the field of the modality. Because in magnetotherapy, we have limited range of the use compared to CIS. Superinductive system penetrates up to 10 centimeters into the tissue. So we know that we can cover the tissue we want to treat. What about the electrotherapy? So first of all, the main and the basic difference is that the electrotherapy generates currents from the device. And the difference here with the superinductive system is that the currents are generated on the tissue. So the electromagnetic field goes to the tissue and it creates the current in the tissue. So this is the main difference. But also, as I told previously, the difference is with the penetration depth, because most of all situations with the electrotherapy, it is usually superficial. And the depth of the penetration in superinductive system is up to 10 centimeters. What is the also the difference? Let's say about a little bit about product features, is that it's impossible with superinductive system to burn the patients. Of course, when we have the electrotherapy, we have to use electrodes. We have to use wet sponges to apply those electrodes. It is the risk of burn. It is also the consumables additional. About superinductive systems, this is totally consumable-free device and also operator-free device. So this is a huge advantage because this is very comfortable for the patient, very comfortable for the therapist, but also very effective. So we have covered all principles we want to reach. What else with the superinductive system in comparison to electrotherapy? We can use this device in the full contact with the skin, but we don't have to use this full contact. We can have a small gap between skin and the applicator. The example is, for example, the example is when we have some kind of fracture and we want to support the healing process of the bone. So we can do this over the cast. So for example, if we have the fracture on the forearm and we have a cast, we can just apply the superinductive system over the fracture on the cast, and we can stimulate the healing process of the bone. So let's go through the clinical background and the point we are focusing on regarding the pain management. So as you can see on the graph on the right, we are using different ranges of the frequencies. So all this range, all those ranges, they are covering different pain control theories. So as you can see, we are covering the endogenous opioid theory of pain, which is intended to the chronic conditions. We are covering the gate control theory of pain, which is intended to subacute and acute patients, and peripheral pattern theory of pain, which is intended to subacute patients as well. So we are covering those three pain control theories to be sure that we can manage the pain and we can relieve the pain. What are other medical effects? As I told you before, when we create the depolarization of the nerve and it causes the muscle contraction, we can use this muscle contraction to the joint mobilization. We have the specific frequency range to achieve repetitive contractions of the muscles surrounding the joint capsule. So this is something like the substitution of your work. So it can substitute your work or prepare your patient to other methods you are working with in your clinic. So this is the point we can focus on with the patient. So for example, if we are working with the patient and we want to apply superinductive system on the spine, we can fully do this and work with the superinductive system, and during this time, for example, work with the upper or lower limb. So we save our time, save our effort, and also we increase the healing process and we short this healing process. What about fracture healing? Here, the high-intensity electromagnetic field enhances the blood circulation in the affected area and supports formation of the vascular and cartilage callus. So we actually see that the bone is healing much faster. We can fully recommend it to increase the healing process with the fractures over the cast. Also, we can put it over the clothes, so the electromagnetic fields goes through the clothes, to the materials, and we still can achieve the support of the regeneration. Regarding the other medical effects, very good option and the specific protocol is in this device regarding the spasticity reduction. So inhibition of an increased muscle tone is achieved through affecting the spinal level of the muscle tone control. It means that we are losing the increased muscle tone on the spasticity first, and then we are working on the weak muscle to make it stronger. So actually, this is the great option to prepare patients to gait therapy, to hand therapy, to help the post-stroke patients or cerebral palsy patients or SM patients to be more functional, to work with their daily activities much better and with much higher quality. And myostimulation, this is like the basic point you might had in your mind if I told you about the depolarization and of the nerve and muscle stimulation. So in case of the intensity we will apply, we will decide what kind of stimulation we want to reach. Because myostimulation, it doesn't mean only the strengthen the muscles. We can also relax the muscles, but this is up to the frequencies, the specific frequencies, and the specific intensity level. And about the therapy guide, what is the main difference and the biggest advantage of this device is that this is the modality which is determined by the two parameters, and this is very unique on the market, and this is the only device I know with such a specific frequency modalities and intensity modalities. What is the effect of this? Because in this superinductive system, we are using the frequency modalities and electromagnetic field intensity modalities. In every preset protocol in this device, we have sequences, and this sequence is made by sections. Every section has different modality of the frequency and different modality of the intensity, which means that the tissue which is treated is fully engaged into the treatment, and it doesn't adapt. So we never know, actually the tissue never knows what kind of the frequency and what kind of the modality of the intensity it will receive because it's not a circle. So every section is different. And as I told you before about the frequency and the pain management, you can see here the different ranges of the frequencies which are intended to different effects we want to reach. So if we are working with the chronic pain management, we are using 2 till 10 hertz to reach the endogenous opioid theory of pain. If we are working with the acute or subacute pain management, we would use the 60 up to 100 hertz to cover the gate control theory. If we are working with a subacute patient and we want to manage the pain, we would use 100 up to 140 to cover peripheral pattern theory. But also what we see, we have the specific ranges of the frequencies to cover fracture healing, to create the joint mobilization, to have the myostimulation and spasticity reduction. So regarding the frequencies, we have modalities of the frequencies, and we are focusing on the pain management. But also, what is very important here is to apply adjusted intensity to the patient and to the goal we want to reach. So we have 30 seconds from the very beginning to adjust the intensity to the level which is comfortable for the patient and which is effective from our point of view. Because if we want to relax muscles, we will not apply as much intensity as we would use For example, if we would want to strengthen the muscle. So we have first 30 seconds to adjust the intensity. And after that, we are not changing intensity at all. If 30 seconds is not enough, we should stop the therapy and run it again. And this is the time where we have to find the motor point we want to treat and to apply the exact intensity level. So I will show you now a small demonstration of how actually this device works. Because unfortunately, you cannot feel it on your skin how this device actually works on the tissue. So we can fully recommend to use the applicator on the 6-joint arm. It is very easy to change the position with the patients, but in case that I am now the patient and the therapist, I will just remove the coil, and I will show you that here, this is the center of the electromagnetic field, and also we can see it here. And this is the point, and this is the point we are focusing to cover the motor point we want to reach. So now I will upload the protocol, for example, to repair the nerve. And we have 30 seconds, as I said, to upload the intensity. I will not hide that I had to check what kind of intensity it is good to apply in example of nerve, in example of muscle, to be sure that you know how small intensities we need to apply. But in this case, that I have some limitations to present you how the device works and how the treatment looks like. I had to prepare it before. So I will start with the therapy. And the point is to find the motor point. And in this case, I am working with the nerve. So I can decide, in this case, that I want to stimulate the nerve. If I want to stimulate the muscle, I should apply the applicator on the muscle belly. And I should definitely change the protocol, because in every disease, in every effect we want to reach, we have different protocols. Those protocols are very good prepared. They are very specific in every option. So you should be secure in every case. As I will show you later. You can hear now how the magnetic field works. You can see how the magnetic field works, and I am actually feeling the tingling, the very small vibration. I am not. I don't want to upload big intensity in this case, because if I would, it would be uncomfortable for me. So as you can hear now, right now this is the third section of 7 in the sequence in this protocol. Usually the protocols, they are around 10 minutes. Some of them they are a little bit longer, some of them they are a little bit shorter. So the protocol is very simple and very easy to adjust, and very easy to set. Okay, so let's change the protocol. And we can do this easily. I hope you can see it. We can do this easily with our screen. I am sure that most of you had opportunity to work with the BTL devices, and every BTL device is created in this way to make it the easiest to set the therapy on. So if you had opportunity to work, for example, with the shockwave therapy and even the essential physiotherapy solutions, you will know how to operate this device. So it is very easy to set the protocol and to run with the therapy. So we can go through the list. We can go with this anatomic body part, or we can go directly through the list. So it is up to us how we want to find the protocol. So let's go right now into the muscle strengthening, and please listen now how different first section when we have to set the intensity level, how different frequency it is. So as you can see, this protocol is much more intensive, and up to the disease we want to treat, we are uploading the different protocols. So we have a lot of protocols here regarding the acute or the chronic patients, regarding the trophic enhancement and circulation enhancement. We have spasticity reduction protocol. We have as well the joint mobilization protocol, and so on and so on. We have so many protocols here, so we can cover many recommendations and many indications. So as you can see now, in the very beginning, the first 30 seconds were quite intensive, and now the frequencies and the intensities, they are changing, so they modulate. So that is the reason why after 30 seconds we are not changing the intensity, because after that, if we would change the intensity in other frequencies level, it might be uncomfortable for the patient. So right now we have the third section of 10th, and this protocol is 13 minutes. So it still is not a long protocol, and it is necessary. It's not necessary to elongate those protocol. It is enough to put this protocol to the patient's tissue, because we are sure that the tissue doesn't adapt and it's fully engaged and fully involved into the treatment procedure. And after the treatment, the tissue might be a little bit tired. So we know that even if the treatment is very comfortable, it is very pleasant, and the patients, they adore this kind of modality. We need to be sure that everything works fine, and after the treatment, even if this is very pleasant, the tissue will feel that the treatment happened. I would like to show you as well what is the difference about myostimulation regarding the muscle relaxation. So you can hear exactly how the first frequencies look like. I don't need to put the very high intensity of the electromagnetic field. Right now, this is only the 9% of the maximum intensity. When I put the program with the nerve repair, I put only 5%. So it is not a big value of the intensities we need to load. So in this case, we have to adjust every time the intensity level of the intensity level in every session, because every day is different, every patient is different, and every stadium, every disease is different. So every patient has to be treated individually and has to have adjusted the intensity in a different way. Even if it's the same patient, like on the first, second, third session, uh, every time we adjust intensity individually, even if in the very beginning the patient had, for example, 20% of the intensity, it doesn't mean that next session he will have also the 20%. It might be lower, it might be higher. It is up to the body condition. So as I told you, this treatment is very easy. So we can use the suitable protocol. Of course, we can use the manual, and we can create our protocols by our own, and we can use the specific frequencies, modalities, and intensity modalities to create our own protocols. But also we can use the preset protocols, which are default in the device. So we define the therapeutic area. So as I told you, we have to put this center point of the electromagnetic field, because it goes in the focus way into the tissue, to be sure that in this case we will stimulate the area we want. So let me show you also that still, if we have some small gap between the surface of the applicator and the treated area, it still can create the muscle contraction. I will try to do this as much visual as it's possible. As you can see, I have a small gap. Of course, in this case, if I want to create the muscle stimulation and muscle contraction, I should apply much bigger intensities, because in this case, if I would have full contact with the skin, I definitely would have to decrease the intensity of the electromagnetic field. But still, even if we have small gap, we can create the stimulation of the nerve, of the muscle. So it's still the tissue still reacts, and we can still work with the patient if it's impossible to do this directly on the skin. So as you can see, we have very different recommendations regarding the patients we want to treat with this modality. So as I told you before, we can treat the acute and the chronic and subacute patients. So we have a little bit different recommendations, how often we can use this device, and what is the number of the therapies in one session. In my experience, I can tell that usually from the first 2 sessions with the patients, I know how often and how to work with the patient with superinductive system, because actually after first session and when the patient comes to the second session. We are doing again the interview. We are checking everything. We are doing the diagnostics, and we know how the human body, how the patient's body reacts on this kind of modality, and how regenerates and how heals. So in this case, this is very individually. Of course, this is the recommendation, and it is fully safe. Of course, in acute conditions, we are using this daily. In the chronic, we use it 2-3 times per week. It is up to the goal we want to reach. If we want to strengthen the muscles, the muscle can be a little bit fatigued, so we should have some time for resting. And this is up to the patient, of course. If we have the neurological patient and, for example, the sport patient, both of them, they will react differently, and we will have different goals to reach. When I had opportunity to work with a volleyball team of women, I knew that they have no time to have a rest. Of course, they rest because they are working like training, eating, sleeping, and this is like the circle. And after the week of the trainings, they have matches on weekends. So we had no time to actually recover, but we had time to increase the number of the therapies in 1 week. So it was good opportunity to enhance the healing process in their conditions. And it was also the acute sprain, ankle sprains. It was disc issues. It was some muscle fatigues, muscle overloading. So it was many diseases, many problems we had to take care of. Regarding the contraindications about this device, we have to be sure that in case of using the electromagnetic field, the pulse electromagnetic field, we have to be sure that the patient has no implants and electronic and the metal, because in this case the metal can burn, can overheat. What is the contraindication? This is the growth plate area, but there's some exception of that. The example is if we are treating the Osgood-Schlatter disease, and usual we are thinking that Osgood-Schlatter disease is this is the disease which is with young children playing football. So how to avoid the growth plate. So this is the exception. But also, if we have, for example, the children, let's say teenagers with the cerebral palsy, and we want to decrease the spasticity, and still we know that we will cover the growth plate area. So we have to inform our patients and their parents that, of course, this is the contraindication, but the advantage what will come from using the superinductive system in the spasticity reduction, it is much more valuable than the growth plate area. Of course, the total contraindication is the head area, so we cannot apply it on the head area and in the front part of the neck. Regarding the heart area and broad disorders, you might ask about thoracic spine and neck. Of course, we can apply this device and this modality on the neck and on the thoracic area, but we have to be careful with the intensities, because patient will tell us that he doesn't feel very comfortable if the intensity will be too high. So with these areas, we have to be very careful, and I'm sure you will see that the tissue reacts very quickly. Of course, the contraindication is also the drug pumps and usual contraindications for every physical modality. So this is like tumors, fever, pregnancy, and so on. So in this case, we have to be secure that we cannot apply this modality. And what about the product features? As I told you before, we have so many product features from the beginning about the how the patient how the patient likes this modality, because in my opinion and in my experience and from the experience on the Polish market, this is one of the favorites modalities for the patients, and patients adore this kind of feeling. Because mainly when they come to the physical therapy or physiotherapists, they know that they will suffer in the clinic, because usually we are working with the pain, and this is the exception of this, and this is very comfortable treatment for the patients. What else? It can develop your clinic, so it can support your work, and it can increase the level of the patients in your clinic very easily. This is the device which can work with you. So this is like your another tool to work with, to enhance your work, to enhance your practice, to help your patients to recover faster, to reduce their pain, to resume their daily activities. And from the other side, it is very easy to use. It is operator free. It is consumable free. And from the other side, regarding the product features, we have the preset protocols. So you can just set and run with the therapy. You just the one thing you have to do is to apply the applicator into the treatment area and adjust the intensity. We have also here the quick protocols. So as I told you, we have the list, so we can decide because we have the body part navigation, so we can decide from body part navigation and from the list what kind of protocol we want to choose. But also, if we have some kind of favorite protocols, in case of the patients who are coming to our clinic, we can decide about our quick favorite protocols. So actually, every preset protocol typically covers more symptoms of patient's condition and saves operator time. Every of our devices and superinductive system as well, in every preset protocol, we have encyclopedia with full explanation how to work with this protocol, how many times per week we should apply this modality, how we work with the session, what is the level of the treatments per session. So we can see here very exactly. What else? We can see here on the screen how to apply the applicator. And one of the biggest advantages in this case, and with other BTL devices, is that we can still mix this device with other therapies. I mean, with other therapies, also the other modalities, but also the different methods of the physiotherapy. So this is the huge tool for physiotherapists to work with this device, and which helps, supports, and substitutes some of our work. So it is one of my favorites, next to the focus shockwave and radial shockwave and other modalities. This is one of my favorites, and from time to time, I catch myself into the thinking when someone asks me for some kind of let's say muscle issue or tendon issue or joint issue, and they ask me what to do. So my first thought is to do superinductive system, because this is very easy. So the reaction is very quick. We can treat here also the acute and the chronic patients. We can work here with the sport patients, with the neurological patients. It covers lots of tissues. So we can work with the muscle, with the tendon, with the joint, with blood circulation, with bone. So actually, almost every patient who comes to the clinic can be treated by superinductive system. Regarding the applicator, as I told you, we recommend to use the 6-joint arm. For the demonstration, I had to remove it because I was the patient and I was the therapist in one. So it wasn't easy for me to adjust the applicator on the arm. But we recommend to use the six-joint arm. It is very easy to change the position, so we can fully decide how the applicator should be in which position. And this is full operator-free therapy. So in this case, and especially during the time when we have pandemic situation, and in many countries, physiotherapist clinics, they are closed or they are starting to be open. Our patient will be afraid to come to our clinic. And if they will come, they will try to keep all the safety recommendations. And it is a great tool to have operator free, to don't touch the patient, or to decrease the contact with the patient. So this is the amazing tool for now, especially to work with our patients. What else? If we are thinking about the applicator, we can be sure that it will not overheat because it has patented cool flow technology, which means that it cools down for the whole time of working with this device. So we have no worries that if we have patients one by one, we have to wait till the device will cool down. No, we can work from the very beginning of the day till the very end, one by one, only to disinfect the place where it is the direct contact with the skin. And we don't have to worry about this. The device can work with us all day long. So this is actually all I wanted to share. I hope that you enjoyed my presentation, and I hope that I could share with you with many of my thoughts and my experience. In general, let's summarize this device. This is the amazing tool for you to enhance your abilities to work with the patients. You can work with the sports players. You can work with the neurological patients. What else? You can also work with the patients who are waiting for the surgery, or they are right after surgery, because this is the device which will create the muscle contraction, so we can prepare the soft tissue before the surgery, to be sure that after the surgery the patient will recover faster. So this is the next goal. So actually, when we have some kind of idea what kind of goal we want to reach regarding the muscle relaxation, muscle contraction, nerve stimulation, blood circulation enhancement, healing process of the bone, we can do actually what our imagination has in their minds. And this is a great tool to cover all those goals, and we definitely will reach those goals with this device.